have been recorded in the past 24 hours. It's the second straight day of figures surpassing the 3,000 mark, with Gauteng Premier David Makhura announcing yesterday, as you saw, that the province was officially in the third wave of infections. 112 people also died during the COVID-19 related complications, taking the overall death to 55,124. The recovery rate has declined slightly to 94.6%. The numbers of active cases has increased to over 31,000. The number of vaccinations completed under the Sisonke Protocol increased to over 474,000. Well, let's chat a bit about this now. The acting director at the National Institute of Communicable Diseases, Professor Adrian Puren, joins me now live. Prof, a very good evening to you. Thanks indeed for your time. So a third wave of infections already having hit Gauteng. The numbers have more than doubled, according to the Premier. The Free State, over 40 people dead there in the past 24 hours. The Northern Cape, KwaZulu-Natal also worrying. Do you think that we might soon be declaring a third wave for the entire country?
Well, I think we're getting closer to that particular point again. I think we can't necessarily predict when that will happen, but I think we do have some indicators. For example, if the cases per day reaches, let's say, 5,000 or just above 5,000 cases per day, then technically we are in what is called a third wave. But for all intents and purposes, we've seen what we call the so-called upticks and upswings. The numbers have been increasing over time. So in essence, we are approaching the resurgence, if you like. So technically, I know it hasn't been declared as the third wave, but we will be there, I think, fairly shortly.
We know that in the Western Cape and KwaZulu-Natal, some super spreader events, matric farewells, for example, contributed to the increase in numbers there. Have we been able to trace exactly why these numbers have risen so drastically in Gauteng and the Free State, for example?
Yeah, I think it's been very difficult. I think there'll probably be multiple events, for example, either congregant events, super spreader events, and clusters, in other words, where people have come into close contact with each other that has led to an increase in these numbers of cases. I think it becomes very challenging when you have such numbers to really do good tracing and track and isolation and quarantining, but I'm sure the provinces are really putting their best efforts to try and achieve that objective. But when you get to large numbers, it really becomes very difficult, and therefore I think re-engagement with communities around our so-called risk communication strategies about the wearing of masks, wearing them correctly, the physical distancing, not being in congregant and high close contact, ventilation. These are all the key things which, when I listen to your clip, is not happening.
Yeah.
So I know that last week, for example, the NICD, as part of the modelling consortium for COVID-19, certainly expressed the view that we could probably have a second wave, or a third wave, sorry, that is to a lesser extent than the current wave we're coming out. But I think, listening to your clip, again, we can't always predict what those scenarios are, but if we continue not to practice those non-pharmaceutical interventions, I think we could be heading to large waves, especially in Gauteng. Gauteng was the, if you like, the anomaly of all the provinces in terms of what could be expected in terms of a larger wave approaching the second wave, for example.
And I guess, Prof, when you talk about that third wave, the concern, I guess, would be for Gauteng, because you have many people working in this province, but generally are not from here and would travel to different parts of the country, sometimes over weekends. We've seen in that clip, you heard in that clip as well, that despite the announcement of there being the third wave of infections hitting Gauteng, no one seems to listen. Another issue, electioneering, campaigning for the local government elections, also expected to intensify in the next couple of weeks. I mean, how do you see this panning out, given that with electioneering, you kind of have these door-to-door campaigns taking place?
Yes, I think, I suppose the Department of Health, together with government, together with the various parties, will actually have to look and see and how to determine to reduce risk as best as possible in order for the democratic processes to take place. But again, it's matter how are we going to manage those particular risks? Again, I think we've always spoken about smaller numbers of people, the less contact, being in open spaces rather than in closed spaces. So those are the types of thinking that will have to go into these particular processes. I think we've really struggled in many ways to try and engage communities to have the non-pharmaceutical interventions implemented appropriately, sometimes for good reason. It really is challenging to achieve that. We've got a virus that is highly transmissible, and we've had a variant, for example, that was highly transmissible. So I think, yes, it is very challenging, but I think we should try and make every possible or conceivable effort to try and ensure that these non-pharmaceutical interventions are implemented as best we can. We're not at the point where we have sufficient vaccine coverage, for example. You've just mentioned the figure of about over 400,000 individuals, and those are the healthcare workers, and I think that's great. I think that's very important because our healthcare system is vulnerable. Our healthcare workers are in that vulnerable group. So I think that's an important milestone for us, at least.
And in fact, Prof, that was my next question, talking about the vaccination, the second phase of the vaccination program. Not all healthcare workers have been vaccinated. The numbers, are obviously expected to be incredibly high as they join those 60 and over to be inoculated from next week. What does this say about the pace of our vaccination program in South Africa?
Well, I'm sure that the Department of Health needs to know, it does know its particular targets. I think they're going to make probably every effort as possible. The third wave, we can try and stave off. We don't want to reach that 5,000, but try and stave off such events by, in fact, having an enlarged, rapid, efficient rollout, I think is really going to be critical. And I think the Department of Health is quite sensitive and aware of programs that have achieved those objectives. When you look at, for example, the United Kingdom, the United States, Chile, and other countries, even though they had sufficiently large waves, by actually expanding, the vaccine program, they could certainly achieve a decline in cases. So I think that's probably what we have to look forward to, I think.
And exactly how ready are we for this second phase, given that there's still challenges? There have been challenges over the past few days with regard to the inoculation of the remainder of those healthcare workers. How ready are we to proceed?
Well, I'm afraid I'm not in that position. I think it's a question that you would have to address to the Department of Health and the Vaccine MAC, specifically the advisory committee, to give you a better sense around that. I think I'm just affair with what some of the logistics would be, some of the challenges would be, but I think they would be best placed to answer that question.
The Acting Director at the National Institute for Communicable Diseases, Prof. Adrian Puren, thank you very much indeed for your time this evening on the programme.